But the other way that people expressed betrayal is they felt like they were sent into these highly dangerous situations, and there was absolutely no one there who seemed to give a rat's ass. And so that's actually what one nurse said in the UK. This was the National Health Service. She said, "If I die, they don't care. They'll just get someone else in my shoes tomorrow." And so they felt like that, especially the management. But some people actually said higher up, even, that the culture and society had just betrayed them. Hi, everyone. Welcome back. Listen, I wanted to give an update on the work I've been doing on the moral injury in healthcare providers article. So I've kind of had to have a rethink. I got a bunch of comments back from reviewers, and I completely rewrote the paper. Honestly, I think it's better, but I did come up with some kind of new ways of framing this, and went back to the literature, pulled in some even more recent studies. So now, actually, what you're going to hear about, or what I'm going to talk about, is a compilation of about 46 recent empirical articles, some qualitative, some quantitative. About three, I think, used mixed methods. Anyway, this is actually going to be published in the journal Traumatology. They have actually accepted it. And it's talking about, again, this idea of COVID and healthcare providers and how COVID affected healthcare providers to the extent that they started using a construct that had pretty much only been in the military literature, which was moral injury. Okay, so what is a moral injury? Well, basically, a moral injury is when someone, oftentimes a commander or somebody in a leadership position, a trusted authority, gives an order that causes a feeling of betrayal, and that actually the person is either forced to act in a way that violates their moral beliefs or witnesses something they can't stop. And oftentimes it's a situation where it's just so horrific that they just can't forgive themselves for either acting or failing to act. Okay. And so prior to COVID, that had mostly been in the military literature. And COVID really changed things. And this is actually what one physician said. Said the COVID-19 pandemic was a different kind of crisis because it put an enormous, unprecedented strain on all healthcare systems worldwide. Okay, so the normal things that cause stress, look, the long hours, the kind of overwhelming workload, oftentimes with fewer resources, was just exacerbated by the situation of COVID. This affected not only people working on the front lines with COVID patients, but a lot of other patient care changed as a result of kind of regulations and infection control measures that came in. So that's really kind of what I want to talk about, is kind of like, how do you understand this? And the goal of this article was always to kind of say, is moral injury the right construct to use to describe the reaction of these healthcare providers? Or do we need another construct to talk about, kind of what their experiences were? Because a lot of people have said, oh, come on, healthcare providers haven't gone through anything near what, soldiers have experienced. And I said, well, that doesn't seem to be true based on what they're saying. So that's what I really sort of sought out to do, is kind of endeavor to do that. And so I'm going to actually share my screen real quick. Okay, so the first question I wanted to address was this. What happens, when you are trying to differentiate? This is something one of the reviewers asked. How can you tell the difference between post-traumatic stress disorder and moral injury in these healthcare providers? And that actually does raise some good questions, because if you look at what they described and what their life was like during this time, you can actually see that there is actually a lot of overlap. Okay, so you can actually consider these two things, the experience and what is the possible exposure. In other words, kind of what is the thing that kind of sets them up for symptoms of harm. Okay, so the first thing, and this is what is actually complicating trying to kind of understand, is moral injury a good construct to use? One of the things that is important is to kind of understand that actually healthcare providers were subjected to criterion A events. So what is that? So in the PTSD literature, criterion A is the one we use to talk about, does the event rise to the level of severity? And over the years, there have been a lot of modifications to criterion A, but the one we have right now, I think you'll see kind of fits. So it's either death or threatened death, actual or potential physical harm, actual potential sexual violation. Okay, so you can actually kind of see, again, that's sort of pretty, high bar of severity. But really, when you listen to what the experiences of these healthcare providers are, you understand that they actually did experience this, that they did experience danger to not only themselves, but others. And, it can actually happen by either, direct experiencing or witnessing or hearing about close friends or family members. So all of these things are considered a primary exposure to post traumatic stress disorder. Okay, so you've already right there, when you're trying to say, okay, well, is this moral injury and is this PTSD? They've actually experienced both. In addition, they've also experienced a secondary trauma, which is that they witnessed suffering and death of others on a large scale. And so these are really kind of things. So you've got primary trauma, you've got secondary trauma, and then also finally, uh, they either perpetrated or witnessed violations of their ethical or moral beliefs, okay, which led then to moral injury. Okay, so then you see symptoms, that look like this. And so, can you really say, okay, this one's from post traumatic stress disorder and this one is actually from moral injury? Honestly, you can't because they do overlap quite a bit. But you can see there's a whole line of symptoms, including, by the way, PTSD, not surprising, considering the events that they experienced. And they actually talked about this. This was one of the things that they were worried about the most was how this work of theirs was going to actually affect people that they loved. Okay, so here's what a couple of providers said. This was in one study. They said healthcare providers daily place themselves in harm's way to treat patients and were exposed to death on a large scale. When the pandemic began, frontline workers were deeply concerned about contracting the virus and becoming ill. Initially, we had limited information about the spread of the virus or the likelihood of serious illness or death resulting from infections. The more patients with COVID-19 the trainees cared for, the greater these concerns. Okay, now this one was from a nurse at the UK National Health Service. She said, "It is my fear that I might get COVID and then pass it on to my husband, and we would both die, and the children would have nobody." And so this one physician described it this way. And this is when I think, this was written kind of early in 2020. And I think she was definitely sounding the alarm. She said, "As with soldiers in war, we know that as soon as we stop doing, we will start feeling the deterred processing of grief and trauma and betrayal for the patients we've lost, the tragedy we've witnessed, the risk foisted upon us by failures of organizational foresight will threaten to overtake us. It's hard to know where we are safe." And I think that really does give you kind of a good idea of the types of exposure. And they're already kind of starting to hint at the fact that this was really mismanaged very badly by people in charge. Okay, so then that brings me to the second chart, which is this. I started kind of trying to think how to frame this. How can we discuss moral injury? Because, unlike post traumatic stress disorder has been around as a diagnosis for a while. And unlike post traumatic stress disorder, moral injury is not a formal diagnosis yet. I think that's coming. People have been kind of working and working and working on this. And so we're getting a pretty good sized literature. So to kind of answer that and kind of what are the characteristics, the key elements of moral injury? And then we can look at, do these apply to healthcare providers and their experiences during COVID? Okay, so I arranged these. This is actually from a review article. 124 articles were included that all had definitions of moral injury. Okay, and so what they tried to do is go through all these articles and pull out what were the essential themes. And then they grouped them into what they called seven definitional themes. And so they kind of, what I did is I grouped them in an order, thinking about how they might be experienced kind of firsthand, like if you were walking through this. So they are ethics, high stakes environment, orientation. So that means either yourself or other people did it, betrayal, psychobehavioral wound, and spiritual wound. And then finally, reconciliation. Do you get any relief from this? Okay, so let's start with ethics. Okay, so in the Richardson et al. 2020 review, the definition of ethics, that's our first thing. And we're kind of assuming, like on a timeline, that these are actually this is the first type of exposure. In other words, the people before the COVID crisis hit, they actually had already ethics and morals kind of in place. It could be professional ethics, could be personal ethics. For physicians, it could be something like the Hippocratic Oath. A lot of other fields have similar types of values and stuff that they do. And the idea is that you're going to treat patients with care. So, this is actually how Richardson et al. Defined ethics: transgression of personal beliefs or expectations of justice and fairness toward other, a disruption of beliefs about what's right. And again, I said this was something that came through absolutely loud and clear, that people felt like they were having to do things that were wrong. This was what one nurse said. She said, it is emotionally challenging to force a nurse to pick between what is morally right and what is viable or affordable in a given situation. A nurse is obligated to provide compassionate care to each patient. However, during this pandemic, nurses are simply unable to provide this level of care. Many nurses are taken by a sense of helplessness, question their abilities, and are forlorn and frustrated at the bedside of a patient who is cut off from family and friends, dying alone. And that was from an article by a group of nurses called, lead author was Hussein et al. 2020. Okay, so you kind of get an idea that, this is something that really was bothering them. And another one said this was talking about residents. The inability to do their duty may be at the heart of the moral distress experienced by COVID-19 clinicians. Providing the optimal standard of care becomes a mathematical impossibility. People who feel that they are called as healers in the altruistic Hippocratic tradition must stand by powerlessly as their patients get sick and die, a tragedy that can cause serious moral injury. So I think you can say that ethics were definitely something that a lot of people cited. And again, looking at studies where they collected data on this was something that was an issue for more than half, oftentimes 60 or even 70% of clinicians talked about this. And this was from a qualitative study that was both in the UK and Australia. And they said that COVID led to a dehumanized medical care, and staff sorrowed over having to obey these policies. This is what one nurse said. She said, having family members ask me, can I take off my mask to kiss my husband goodbye? And then she said, you don't forget these kinds of things. They're so very, very traumatic. Okay, so the next factor we've looked at is the high stress environment. Okay, and so that actually was something that Richard and all defined as urgency behind decisions with life or death consequences. Certainly, we had that. Okay, and so there were actually a lot of people that did talk about that, and certainly, that was actually, I think, in the last group of quotations as well. People just talked about, this impossibility. You have all these patients, you have limited time, you have limited resources, and what can you do? And so, very, very high stress. Okay, so the next one is orientation, which is committing immoral acts, failure to stop sex actions, or witnessing of immoral acts of others. Okay, and so again, this was something that was absolutely written throughout. Many of the providers talked about this. This was actually something that, like one study here in the UK, in a public health facility, found that self-perpetuated acts cause more harm compared to other perpetuated acts, but 64% reported moral distress because of their actions or failure to act, compared to the moral distress rate of 26% for inactions of others. So again, that was something that was pretty strong. And so this is actually what somebody else talked about in terms of kind of the orientation of this, this idea of self versus others actually causing harm. And they said it just didn't actually make any sense when everybody was telling them they were great and they were heroes. This is what one nurse said. She said, I almost wanted to tell people if they knew what had gone on and if they knew how bad things were, you wouldn't be clapping. You'd be writing petitions and storming Parliament. There was guilt because people were actually praising us for what we were doing, but you felt that the things fell way short of where they should. So again, it's that idea that they can't quite, people are saying all these good things about them and they didn't really feel it was true. Okay, so the next one is betrayal. And I will say, just, in terms of going through this literature, now for several months, this was probably the most common theme. Betrayal came out in so many of the articles and it was just devastating. Okay, so Richardson et al. Defines it like this: betrayal by an authority figure or someone who holds legitimate authority in a high stakes situation. And this was one of the primary elements for meeting criteria for moral injury. This included actions by people in authority and violating one's values because someone in authority commanded them to do it. Okay, so again, betrayal. But the other way that people expressed betrayal is they felt like they were sent into these highly dangerous situations, and there was absolutely no one there who seemed to give a rat's ass. And so that's actually what one nurse said in the UK. This was in the National Health Service. She said, "If I die, they don't care. They'll just get someone else in my shoes tomorrow." Okay. And so they felt like that, especially the management. But some people actually said, higher up, even, that the culture and society had just betrayed them. Here's another one. This was actually from US Veterans Affairs. "I was desperately trying to do what I felt was right and best for my patients. I felt like my coworkers and I were betrayed and abandoned and left to do more with less and less." Okay, another nurse said, "We got lip service and no actual action. It was demoralizing. It was disheartening." So again, this was just something that was so big. And a lot of people just didn't feel like they could get over that. For them, that was just it. Why am I doing this? You're asking me to take on this incredibly dangerous task, and you're not even giving me proper protective equipment. Okay, so that led then to the next one, which is the psychobehavioral wound, which Richardson defined as emotional or behavioral challenges caused by moral injury, such as remorse, anger, self handicapping, or demoralization. And I think in many of the studies, that was like measured as things like depression and anger and anxiety. Okay, so this was what one provider said. This was from a group of ICU nurses in Canada. She said, "I was someone who would always go the extra mile, and then all of a sudden, like a switch flipped. I was totally done. I started applying to different jobs. I thought about leaving nursing, and I just couldn't cope at all." So this actually just became so overwhelming that it actually kind of then led to the next thing, which was they called the spiritual wound. So this is actually what Richard defines as it causes moral injury causes spiritual or existential suffering resulting from an interpersonal crisis of personal values and belief systems. And I think actually kind of one of the best quotes of this came from this doctor in the UK who said this: "I didn't feel like I was a doctor. I felt like I was just letting people die." And some of the studies described how physicians and other providers would feel like they were suddenly waking up and realizing they were providing poor care, because they had to detach themselves from the situation. This was actually another one that said healthcare providers anguished over difficult ethical situations where they were faced with unnecessary patient suffering and feeling of not doing enough tend to lead to a sense of hopelessness and helplessness, resulting in burnout. Okay, and so one of the kind of characteristics of burnout was something they called dehumanization, which was treating patients impersonally or mechanically. And that was the way that they thought they could cope with this. But then they suddenly realized it was actually making them feel worse because they knew they weren't doing the job that they were meant to do. Okay. And so burnout, that was actually kind of a different thing. That does not come up in the military literature, but it does come up here and it came up quite a bit. It was actually sort of surprising. And actually, a study that Newsman did in 2023, 2022. Anyway, what they did is they compared a sample of post 9/11 veterans to healthcare providers during COVID. And really, they were similar on all the other symptoms. The only thing that was different was burnout. Burnout was the one that healthcare providers indicated strongly yes. And so I've had some people kind of like brush this off and say, "Oh, come on, that's not serious. That's not like what these soldiers experience." But in a way, if you think about it, it was very, very serious, and that's the way I think the healthcare providers experienced it because it led to losing something that was central to the job that they held, which was that their ability to provide empathy. And once they lost that, they thought, what am I doing this job for? It's just, total existential crisis. It's like, why am I here? What am I doing? I don't really have any right to be here. And so, again, that was something that just came across over and over again. And so then you started seeing things like, functional impairment. And a lot of times people actually found that they were disengaging from other people, including their families. They, had oftentimes thought of harming themselves. And, of course, one of the logical things that would happen is they would leave their jobs, which again is very important. That has really important implications for the healthcare field because, two things that managers, are supposed to care about are things like patient satisfaction, patient experience, and staff retention. And if you got your medical staff and you're already short staffed and you got your medical staff leaving, that's a problem. That's a big problem. And yet it was something that came up over and over. This was a medical stenographer said. She said, I think in general, the last 20 months have been the most stressful, exhausting, and depressing time in my 30-year medical career. I am managing, but I don't know how much longer. Just hiding behind a mask every day is taking an emotional and physical toll. And that was from an article by Evans et al. Okay. And then unfortunately, then you actually had the situation where it led to the increased risk of suicide. Okay. And that's actually the big concern in the military literature because moral injury was one of the things that actually did increase suicide risk. And some of you are probably familiar with this statistic that talks about, that we actually lost more soldiers to suicide, after they came home from the Gulf than we did actually in combat. And so it gives you an idea of how serious this is. But, you start feeling like you're just unforgivable, and the things that you did or you were forced to do or the job you didn't have the ability to do. Okay, so then that leads us to the final thing, which is reconciliation. And this is kind of where you'd hope people would end up. But the fact is, they may not have. The fact is, the moral injury did cause pain that was beyond the person's ability to process. Reconciliation is restoring one's own belief system after violations have occurred. Okay, so again, this was something very few studies talked about, where I think the literature is kind of not there yet. But I did want to say there were some really important resiliency factors, and so some of them were things like, feeling like they had an open culture where they could talk to management. Some felt like debriefing was very helpful. If they had good self-esteem, and if one study found if they had strong religious beliefs, that helped them get through this really difficult time. Okay, so this was actually another thing that a study led by Haggerty et al. Identified factors that could lessen moral injury in some qualitative study of National Health Service workers. They said honest communication, which was transparency from supervisors, visible support from management, including things like PPE and opportunities to rest, PPE being, of course, personal protective equipment, and collaborative problem solving, finding ethical solutions to problems. And so, again, this was something that people have been thinking about, but we haven't seen the studies yet that have shown that people have managed to do this. But there are a couple of things that the National Center for Post-Traumatic Stress Disorder have suggested as possible moral injury treatments. And they actually listed healthcare providers as people who might actually experience this. One of them was acceptance and commitment therapy for moral injury, which helps people live according to their values after moral injury. Okay, there was another one called the impact of killing, which helps people explore the impact of not forgiving themselves for deaths they could not prevent. Developing a forgiveness plan, which includes perhaps writing a letter to persons that were, harmed during this, and developing a plan to honor values that were violated. And a lot of people talk about this, therapists talk about this is okay, what will happen next time? How will you handle this next time? And moving forward, how can you do it better? And then the final thing that they suggested was trauma informed guilt reduction therapy, which helps people identify important values, including those that were violated during the trauma. Okay. And so those, and, in how to live in line with those values moving forward. Okay, so that kind of gives you an idea. So, according to those seven definitional themes, I think we can safely say that yes, healthcare providers did experience moral injury. There's a number of things we probably do need to kind of factor in. There's a number of measures that were used. And so maybe we need to kind of, now that it's not a crisis time, hone in and see which are the more reliable measures. We may need to look at, when people call the same kind of sense of principles moral distress versus moral injury. Some articles said that moral distress was a less severe version of moral injury. Some used the term interchangeably. So that's kind of one of those kind of research things we need to sort out. But kind of moving forward, we can. But I think actually, based on the literature we have now, I think actually their experiences, the healthcare providers experienced, um, you know, all of these aspects, except possibly reconciliation. Although some of the studies on resilience kind of highlighted where we could move, and some providers actually suggested what they would like and what would help them. So, with that, I'm going to actually kind of wrap up for today. Thank you very much for tuning in, and I hope to see you next time.